Pregnancy and postpartum bring a lot of physical changes, and many women don't realize there's support available beyond just rest and recovery.
That's right. And today we're joined by Kelly Risha and Josh Rains from Rains Physical Therapy and Performance. Kelly specializes in pelvic floor physical therapy, and together they're here to explain what pelvic floor PT is and also how you can help during pregnancy after the baby arrives. Guys, thanks for joining us.
Welcome.
Thanks for having us.
Yep.
For viewers who may be hearing this term for the first time, what exactly is pelvic floor physical therapy?
Yeah, so I tell people it's physical therapy just like anywhere else, just more specialized on the muscles, ligaments, and connective tissues that kind of support your pelvis. They also help with bladder and bowel issues, pelvic floor support, stability, so kind of more focused on that.
Okay, so a common question we hear is, can you go to physical therapy while you're pregnant?
Yeah, absolutely. Whether or not you're having pain or not, your body is still changing over 9 or 10 months. So keeping your body strong, keeping you active, and then preparing for labor and delivery can be really helpful with physical therapy.
Kelly, talk to us about some of the biggest benefits for pelvic floor physical therapy during the pregnancy and postpartum.
Sure, yeah. So for during pregnancy, like I said, just kind of maintaining your daily level of function, your mobility. If you're exercising, maintaining a good exercise routine, staying pain-free, whether that's low back pain, hip pain, those pains that are seemingly more common with pregnancy. And then same thing in the postpartum phase, recovering from, labor and delivery. I mean, it's a big event, whether or not you have surgery or not. So just recovering after that as well, just like we do with regular patients.
All right, with a little bit more detail, what types of issues can pelvic floor PT help with, like back pain, hip pain, or urinary concerns?
Yeah, so back and hip pain tend to be pretty common during pregnancy, and those are absolutely treatable with PT. Bladder leaks, bowel issues, pelvic pains, tailbone pain, those can all be treated with physical therapy.
And Josh, you really need to quiet down a little bit. Okay,
I'll try.
Tell us a little bit about Rains Physical Therapy overall and how people can get in touch with you if they'd like to get more information.
Yeah, we're in Aiken, South Carolina. We have a website, we have Facebook, Instagram. We have a lot of doctors that send us patients as well. So your OB, your primary care doctor. Yeah, lots of different ways.
There you go. And again, they specialize in that sports medicine, but also the pelvic floor therapy and more. 803-226-9196. A great way to get in touch with Rains Physical Therapy and Performance when you need that assistance. Guys, thank you so much for joining us.
Thank you.
Thanks for having us. Yep, thanks.